If you've ever been to the hospital before, you've probably been surrounded by multiple people in scrubs, checking up on you, seeing how you're doing, and performing examinations on you. And I guarantee you that at least one of these people has been a physician's assistant. According to Oxford Dictionary, a physician's assistant is someone who is able to carry out routine procedures under the supervision of a general physician. So today I'm going to talk to you about what a career as a physician's assistant would look like, what their day-to-day is like, and also how they become one. So starting off with the job description, one of the biggest parts of being a physician's assistant is that you are an assistant. So you always have to be in communication with other doctors and nurses and making sure that you're on the same page. And they're pretty much able to do anything that a doctor is able to do under supervision. So they can perform tests, they can do x-rays, they can look at medical history, and they can also do clinical research in things like Alzheimer's and cancer in order to make breakthroughs in the medical field. So in basic terms, they're allowed to examine, diagnose, and treat patients. For their daily activities, they typically will start off their shift making rounds, which is where they're updated on patient information, tests, fluctuations in the medical history and the test history of a patient in order to get them on the road to recovery. And then with anything in the medical field, a day is totally unpredictable depending on what kind of cases are brought in. So they may be performing examinations, doing research, as I talked about earlier, ordering tests and x-rays, and also working alongside other doctors and nurses, again, to get those patients feeling better. For the pros and cons, unfortunately, there are some long hours like anything in the medical field, and some days you may have to work on holidays, but we always need doctors, so that's just a sacrifice that you have to make. And the schooling is longer for somebody that would go into another field, but for the medical field, it's actually a little bit shorter, which we'll get to in a little bit. But the pros, there is a high salary and a really positive job outlook, and overall, you're just able to make people feel better and bring families back together, feeling good and healthy. Looking at the salary here, you can see the Indiana national average is $86,830, and here is a map of the salary by state for physician's assistants. This data was actually taken a couple years after my 86,000 data, so that's why the Indiana average is a little bit different, so it's going to increase, which is great, but Indiana does have a little bit of a lower average compared to other states, so it's another good reason to get out of Indiana. You can also see here that the outpatient national average is actually higher than the hospital national average. A physician's assistant can work anywhere that a physician does, and it just so happens that working in a doctor's office will typically earn you more money than a hospital, so that's something to keep in mind when you're applying for jobs. And here at the job outlook, it's expected to increase by 31% over the next 10 years, which is 11% higher than any other job. And here with this graph, you can see that the number of jobs is just going to keep increasing. We always need people in the medical field, so your chances of getting a job coming out of school are really good. Speaking of school, in high school, students will typically take science classes such as biology, chemistry, or anatomy to get a basic understanding of the human body before heading into college. The person that I interviewed was Grant Bramer, and he attended Indiana University with the IU Health program, which is a great option. And he said that you typically will graduate with a master's degree and a bachelor of science in things like chemistry, biomed, biology, or anatomy. And then you're good to get into PA school. So PA school totally depends on the state. Programs range from 2 to 4 years, which is typically shorter than med school for doctors and surgeons. And great programs are at Duke University, the University of Iowa, and Baylor. And in PA school, you will graduate with a complete understanding of all the basics of medicine in things like neurology, hematology, dermatology, cardiology, and everything like that. Once you graduate PA school, you will take the National Certification Exam, which is abbreviated as the PANCE. This has a $475 fee and is 5 hours with 300 questions. It's a pass-fail, so you need to come in ready to take it. And once you pass that, you're ready to apply for your state license, which again, typically will include things like background checks and drug tests to make sure that you are a responsible physician. And then from there, you're good to apply for jobs and maintain your license. Again, most of this is state-based, so you're looking at working a certain amount of hours in the field and things like that. So in general, the education is actually a little bit shorter than doctors and surgeons, which is a benefit. And in conclusion, I think that this would be a great career for me. We're always going to need people that are able to assist doctors and give them new perspectives. And I would love to be a part of a community that is able to help people bring families together and keep everyone feeling nice and healthy.